Good morning. Today, we're going to be talking about mental health in the workplace because the World Mental Health Day is on October 10th. Thank you, Dr. Abiri and Henrietta, for coming on the program. It's a pleasure to have you with us.
Thank you.
Thank you for having me.
Thank you for having me here.
So, Dr. Abiri, if I can just kick off with you, can you start off by talking about mental health? What is mental health? Because there are a lot of people out there who are wondering, why are we talking about this? And why is there a mental health day?
All right. So thank you so much for the question. And I think it's extremely important to dispel that long-held myth that mental health men are not okay in the head. Usually when people hear the word mental, they're quick to think crazy, mad, loony, full mental, and everything else that you can say, yaba left. However, mental actually refers to, the brain, the organ that is the brain. Health, of course, according to WHO, is not just the absence of disease or infirmity, but a complete state of physical, mental, and social well-being. And so when you say that an individual has mental health, it just means that that individual is successfully able to perform the functions of the mind. Now, what are the functions of the mind? The mind functions to think, to imagine, to believe, to perceive, and to behave. And so to say that an individual is actually mentally healthy means that the individual is able to do four things. One, able to cope with the normal stresses of life. Two, able to, contribute their own quota to the environment that they live in. They're able to live productively and fruitfully. And most importantly, these individuals are also able to have thriving relationships with themselves and others as well. However, mental health is not a habit or not habit at all, because there's a continuum. And so depending on life's obstacles, challenges, the curveballs that life may throw at us from time to time, our mental health can take a hit. The hit may come in form of a loss, it may come in form of death, it may come in form of job loss, financial difficulty, hardship. And so every once in a while, we find ourselves swinging between that continuum that is mental health and mental illness. However, depending on the skills, the requisite skills that we have to be able to cater to ourselves and ensure that we're resilient, we're able to anchor better at the point of mental health.
No, I think that's very, very good, because I think it actually sets the theme for what it is we're talking about today. Because today we're talking about mental health in the workplace. And as you mentioned earlier, there's so many things that can, throw one out of kilter. So how do you view mental health in the workplace? How important is it for an employer to consider this?
Okay, so again, it's extremely important to identify that work is good for mental health. However, a negative work environment can lead to physical and mental health problems. Very importantly is the fact that as adults, we spend a third of our lives at work. And we must know that no previous generation of people in history have experienced the variety and intensity of stressors and demands such as ours has. And what we find is that, a lot of people work in places where it's not safe, it's not helpful for their mental health. Now, research has shown, WHO research in 2017 showed that 1 in 5 persons at the workplace would either develop a mental health condition, a substance use disorder, or both. Unfortunately, regardless of how people are affected with mental health conditions such as depression, anxiety, even at work, put on by them by the stress of work and lifestyle, do not get the help that they need. And so why is mental health important at the workplace? It's important because mental health and work are closely linked. A supportive work environment will ensure that an individual is mentally healthy and provides purpose and stability for themselves and the work. But of course, if the work conditions are poor, the individual has dangers to their mental health, their well-being, and of course, that individual is not productive or satisfied with the work that they do.
So can you give examples? Because you've spoken about it a bit vaguely. What constitutes a negative work environment, an unsafe one?
Okay, so an unsafe work environment has or is resultant of quite a number of factors. It may be because of the type of work that the individual does. Is the individual overwhelmed?
Sorry, I need to clarify that. When I say unsafe, I don't mean physically unsafe. I mean mentally. Yes, please carry on.
Right. So there are potential sources of stress in the workplace, and they include things like design of task at the workplace. Is the task load too heavy? Is it one that gives infrequent rest breaks? Is it long work hours? Is it shift work? Is it the kind of work that does not utilize the worker's skills? Sometimes it's the management style, and some people work in places where they feel like there's a lack of participation by them in the decision making. Sometimes it could be as seemingly little as, communication problems in the workplace, or even lack of family-friendly policies. Other factors, that can lead to sources of stress at the workplace include career issues, job dissatisfaction, and you not being sure that by the next day you would even still have a job. Sometimes it's work roles, conflicting work roles, too many responsibilities, too many hats to wear. It could also be the interpersonal relationships at the workplace. Some people work in places where they have little or no support or help from their co-workers and supervisors. And last but not the least is that the environment can be a significant source of distress. Dingy, overcrowded workplaces where there's no form of rest, or there's no form of exercise or a rest room for individuals. These are some of the potential sources of stress at the workplace.
But when you talk like this, there's some people listening to you and saying, in which country is she coming from? This is Nigeria, this is Africa. Why are you talking about all of these things? Didn't we all have to go through all of this? Why is she speaking about all of these things now?
So I mean,
even your quote that you said from the WHO, they're saying, yes. Does that apply to us or outside? Please.
Well, it does apply to us, and it's important that now that mental health issues have become front burner issues, no longer at the back end like we used to put them. The more we know better, we should do better. Now we know better. Now we're seeing the impact of all of this on our individual lives, on lives of spouses, lives of loved ones, even our children. And so at the workplace, now that the information is available to us, a lot of that research and a lot of that data is not just done just because. It's supposed to inform us so that we can take action to make our lives better, even at the workplace.
Now, there are two things I want us to go into. The first is the issue of suicide. I know we just finished the Suicide Prevention Month, which was September. And I want to ask you, is there a relationship between mental health in the workplace and suicide prevention?
Well, so we define mental health already. I think it's important to define what suicide is. Suicide is self-intention, self-inflicted harm in which a person knows that the outcome will be fatal. Definitely suicide should be talked about in the workplace and in Nigeria, largely because in Nigeria ranks 7th in Africa, and it ranks 15 worldwide on the top, nations where suicide is high. It's also very important to talk about suicide in the workplace, because when people struggle at the workplace, when they struggle with horrible bosses, horrible work environments, difficult, challenges that they can't overcome, poor pay, poor welfare packages, feeling dissatisfied with the jobs that they do, sometimes individuals feel so overwhelmed. So again, I think it's extremely also important to talk about why people decide to take their lives by suicide. Research again has shown that in 90% of people who end their lives by suicide, there's usually an undetected, undiagnosed, and untreated mental illness. So more often than not, you would find that people who end up taking their lives due to or ending their lives by suicide actually had an underlying mental health challenge or condition, which may have been brought on by challenges at the workplace. So if we don't talk about suicide and we say we've talked about mental health and we talked about everything else about mental health, then we will be doing a great disservice to ourselves, especially because people also become impulsive, either due to financial difficulties, financial instability, loss of ego. For instance, when they lose their jobs or they can't perform as well as they should on their jobs, they may actually just think, I feel hopeless, I feel worthless, I feel helpless, and perhaps the best thing to do.
Well, people, because there's such a stigma, let's put it in our society about mental health. It's not in my family. It's the famous one that everybody says there's no mental illness. Okay, so in whose family is it? So nobody wants to admit it. And people are afraid that if they let their bosses know they have a challenge, jobs, how do we deal with that? We have people who got bipolar, we've got this and that. And on top of trying to cope with their work, they're trying to hide their problem from their work colleagues.
Well, so unfortunately, all of what you've said, stigma and discrimination, continues to thrive largely with ignorance, with our socio-cultural beliefs and our religious beliefs as well. We're often like ostrich with head in sand. If it's not in my family, it's not our business. But the honest truth, like the WHO will say, is that 1 in 4 persons at some point in their life would have struggled with a mental health condition. So somebody, somebody who knows somebody. There's someone in everybody's family, unless we're not trying to be, truthful to ourselves. And so workplaces need to understand that stigma, discrimination will continue to create barriers for employment, and that workers need support where they work. And it's not just about saying it, oh, we care about you, doing mental health awareness days once a year. Those things are, yes, they start. However, for me, the conversation has to become, that in which, sorry, I got distracted by his raise of hands.
Yes, so just carry on.
Right.
The conversation.
So the conversation has to move beyond just saying that we care about your mental health to creating a culture of kindness, of empathy, of concern, and a culture that ensures that there's a mental health policy that speaks to the specific needs of the individuals who work in those places.
Thank you very much. Henrietta, it's a pleasure to have you on the program. Can you tell us about your organization and what it does for, in particular, if it does anything for mental health in the workplace?
Okay, so good morning, everyone. My name is Henrietta, and I'm in an organization called Anti-Suicide and Depression Squad. So Anti-Suicide and Depression Squad basically entails on raising awareness on suicide and depression, anxiety, and mental illnesses that people go through in life. So linking into the workplace, we've, for example, we've hosted training sections to organizations like Access Bank, even to churches, you understand, where we can raise awareness about issues like this, about workplace conflict, about interpersonal differences. And it is very, very surprising how people actually get into some sort of crisis and misunderstanding with their colleagues. And we can also link it with the managers and the employers, because in most cases, the managers, the employers, the HR departments are basically the ones who was more to the employees based on the too much of tax, most of them are not actually considerate on what people are going through. They just pile up stuff for them. So that could also cause people to go through some sort of mental breakdown. So ASAD is an organization whereby we try to push awareness on issues like this to organizations, and to also train them on how they can be of assistance to their employees.
Fantastic. Dr. Abiri, coming back to you, you had talked about how to create, well, you hadn't actually gone into enough detail, but how do we set about creating that safe workplace? Are there any steps people can take?
Right. So creating a safe workplace is not one person's task. And of course, like I always say, it's not the work of the psychiatrist or the mental health professional. A quote that I like by Vikram Patel says that mental health, there's no health without mental health. And mental health is too important to be left to the professionals alone. And so at the workplace, it's extremely important for the individual to take responsibility first for themselves, for the human resource departments to take responsibility, and of course, for the management to also key into that conversation. And so at the level of the individual, as individuals, we should know ourselves, we should know our limits, we should be self-aware, we should be able to cater to ourselves, educate ourselves, develop ourselves, and empower ourselves. Of course, we also need to reach out in times of difficulty, including if we need to see a therapist, see one. The role of the HR is one that spans across preventive strategies and promotion of mental health as well. It's also very important that the HR does healthcare checks. So before people get employed, there are pre-employment checks, including things like personality assessments, which will help us assess individuals before they come into organizations, and also do a placement. So this individual is very boisterous, very outgoing. This individual is likely to do better in this department. Or this individual is more introspective, they're quite quiet, they're likely to do better, preferably not, facing people. But I think that the biggest conversation is for management. Management has to buy into that conversation, because if management doesn't buy in, then at the end of the day, we find out that we're struggling. Management has to buy in because management has to believe the fact that mental health is important, and as such, we should have a mental health policy. If there's a mental health policy, then it's easier to encourage people to, pay attention to their mental health. Once there's a mental health policy, there must also be what is known as the Employee Assistance Program. And the Employee Assistance Program is a confidential service for employees provided by the employer for employees with personal problems, workplace issues, mental health, and substance use disorders that affect work performance. And so gone are the days when people used to say that, oh, leave your problems at the door and come to work. No, people will come with their full selves to the workplace. And so what the EAP does is that the EAP ensures that the employee is better able to manage their daily life, they're productive at work while facing whatever life's challenges that they might be facing. Wow,
no, this EAP sounds very important. There's some people hearing about this for the very first time, and they're thinking, how do I start? Where do I start? Is this something people can call on you for? Do you do consultancy work? Can you help with setting up those kind of policies that are right for workplaces?
Yeah, so it's interesting that, in this age and time, EAP is still trying to find its footing in Nigeria. Quite a number of organizations that have taken on the EAP are multinational organizations, and you shouldn't be surprised about that. However, some organizations in Nigeria, local organizations, are beginning to catch on. I provide EAP for a number of organizations rather, and I'm actually a member of the Employee Assistance Professional Association. It's a local association in Nigeria, but of course, there's also the international body in America. So yes, it's something that I provide. It's usually when you want to set up the EAP for your organization, you need to do a needs assessment, find what is peculiar, specific, and unique for that organization, find out what their challenges and struggles are, and then after that, you would design a plan for each organization. So it's a very robust program, but definitely what people have found, again, research, is that organizations that have the Employee Assistance Program that provide support to their workers where they work are more likely to find workers who are more empowered, more creative, more innovative, more productive, with little or no errors at the job. They feel safe, they feel very much of a trusted environment. And at the end of the day, the bottom line, which is profit, continues to increase.
Very, very important, that bottom line. And I think if whatever can make that work is a kind of like a win-win for both the employee and the employer, and of course the shareholders. Now, I don't know how much time we have left, but I'm just, very keen on asking you a bit about, the millennial, not the millennial, that's the old one, the Gen Z, the Gen Z, because there's a lot of challenges that employers are having with those younger people and the way they just resign and go. So there's a huge disconnect. How can you help? You understand, this is not just helping the young people, but also helping the employer, because to bridge that gap.
Yes. Well, so I think that things became more apparent after the COVID pandemic, when, people were working from home, and we saw that what we always thought was not possible was indeed possible. And so quite a number of people, including older millennials and from the previous generations, actually struggled with going back to work. However, the Gen Zs are a special breed. And of course, when I say that, I mean that with all due respect. They're special breed because they bring a lot of energy, they bring a lot of innovation, creativity to the table. However, unfortunately, because we will always have mental health, multiple generational challenges in the workplace, the way they communicate, the way they create, the way they share their ideas is definitely different. And so what the EAP also does is that the EAP introduces these people to the workplace and introduces the workplace to this people. At the end of the day, of course, it's extremely important that the Gen Z, everyone, you bring your professional skills, we want your best, and that there are rules and regulations that guide things. But at the end of the day, again, it's a win-win for everyone. Because just because you're Gen Z doesn't mean that, you should take everything for granted. I describe myself sometimes as a Gen Z in an older person's body, because again, I can be quite restless, my ideas keep buzzing all around. So it's not a bad thing in itself. But what we will need to do is to pay attention to, be patient with, and give, all the support that we can give to this new breed of individuals.
Wow. Okay. So, just if I can ask Henrietta. Henrietta, do you have any last words for our listeners before I come back to Dr. Abiri?
Sorry?
Any last words for our listeners? Any advice?
Okay, well, I'm just going to add to what Mrs. Abiri said about the Gen Z, coming from a Gen Z myself. Yeah, you actually said quite a lot of important things that I think people actually need to like listen to, especially Gen Zs like myself. But the idea that, in quotes, the idea that Gen Zs like myself really think is, we say to ourselves is, no one can come and stress me in this life I came to. And at the same time, it's quite true, because no one should stress anybody. But at the same time, Gen Zs are actually quite entitled, in the sense that they feel that, okay, I'm working for you, then basically I should not be your slave. And they just feel, okay, whatever I bring to the table, you accept it the way it is. So just to everyone listening to me right now, Gen Zs, life is really not like that. You have to basically work to get what you want in life. And there are some sacrifices that you have to make in life to get to the certain point you want to get to in life. So yeah, thank you.
Fantastic. Thank you very much for that. We don't have much time, so I just wanted to ask Dr. Abiri, do you have any number for people who want to reach out to you to find more about, more about the EAPS? Do you have a number that they can reach you on?
So I'll leave an email. It's savinglives@redimedconsulting.com. Saving lives, one word, at redimedconsulting.com. It's safer to take emails. Thank you.
Thank you. Thank you so much for coming on. We appreciate both of you.
Thank you for watching. Please like, share, and subscribe for new video updates.